Good morning. I'm Elizabeth Letourneau, and I direct the Moore Center for the Prevention of Child Sexual Abuse. And I'm a professor in the Department of Mental Health here in the Johns Hopkins Bloomberg School of Public Health. I want to welcome you to our 5th Symposium on child sexual abuse from a public health perspective. Welcome to those of you in the audience and to those of you who are joining us online via our live stream. This is our largest audience to ever, and we could not be more excited. As you can already tell, we have an amazing program lined up for today. President Daniels, thank you so much for opening our symposium. And Patrick, my goal was not to cry today. Thank you so very, very much for launching us with an inspired and just remarkably on-point keynote. You've been such an important supporter of our work and our mission. I really can't thank you enough. And the Annie E. Casey Foundation is a remarkable force for good in the lives of children, young people, and their families, both here in Baltimore and all across our country. I want to note that it's not every day where I have my full chain of command in one room. And we have the chair of my department, Dr. Danny Fallon. Danny, where are you? Way in the back. The dean of my school, Dr. Mike Clegg, and then of course we were launched by the president of our university, President Daniels. And I want to take a moment while they're here to acknowledge the difference that these people make. By word and by deed, each has supported the Moore Center's endeavors, even when it seemed risky to do so. And we do take some risks in our work. Later today, we're going to screen a remarkable movie, a remarkable documentary on the lives of registered sex offenders and the people who support registration. In past years, we've invited young, non-offending pedophiles to tell us their stories. We've convened panels of ex-offenders and victims together to tell us their stories. We take risks, but we're supported. On a broader level, Danny, Mike, President Daniels, support science writ large. Each of them has recently written an op-ed supporting science and supporting the faculty, staff, and students who create that science. I am so proud to be part of this team here, and I'm so grateful for all that you do, so thank you. Now, to move on with our program, the focus of this year's symposium is the impact of policy and prevention, so beautifully put together by Patrick. Our goal is to discuss the impact that sex crime policies have on families and communities, the people they're subjected to, and in particular children who are subjected to these policies, and also to focus on prevention programming with young people with sexual behavior problems, and to try to move our country towards a more prevention focus. It's especially appropriate to address these issues in April, which is National Child Abuse Prevention Month. Toward that end, later in the morning, I should say, we're going to hear from our colleagues, Dr. Bruce Taylor and Dr. Jill Levinson, whose work extends these areas. At lunch, my friend and colleague and the Associate Director of the Moore Center, Dr. Ryan Shields, will MC our annual Lunch and Learn event. And then in the afternoon, when we reconvene from lunch, we're going to screen Mr. David, oh my gosh, I've been pronouncing David's last name wrong for a month now, Feiga. Mr. David Feiga's award-winning movie, Untouchables. And then David Feiga will join Dr. Shields, Dr. Levinson, and Dr. Fred Berlin for a panel discussion afterwards. It really is going to be an amazing day. A few housekeeping notes before we get started. Your folders include our center's annual report, a brochure that details today's events. Thank God, because we forgot to put President Daniels' slide up, so that's the guy who was speaking when we first started. Oh, it's just the president of my university. a blank index card for questions. We don't do open question and answer, but you will be invited to submit questions to our movie panel after the movie. There's also a very brief survey to complete before you depart. We take very seriously our job and meeting the needs of our audience. So please complete that brief survey before you leave, whenever that time may be. And then we also have an announcement for a one-day course that Ryan and I teach each summer, this year to be held on May 30th. As you can see from the brochure, we have breaks planned for the morning and the afternoon sessions, and we'll break for lunch at about 11:25. For those of you who have registered for our Lunch and Learn, we'll have guides to escort you up to Feinstein Hall. For those of you who are on your own for lunch, we've got some suggestions back out at the registration table. And everyone is invited to join us after lunch up in Feinstein Hall for cookies, tea, and coffee, and to see our student poster sessions. As it happens, I am our first academic speaker. Patrick gave my talk, so we can just skip it. This is what happens when you invite a good friend and a former running partner to be your keynote speaker. Is he knows everything you're going to say because you've been saying it to him for years. The amazing thing is that he listened, so that's good. I should let your wife know that. For the past 15 years, my colleagues and I have been evaluating the effects of juvenile sex crime policy, and in particular, juvenile registration and notification policies. I'm going to present our latest results from this work in just a moment, but I want to start by explaining why we do these studies in the first place. Evaluating the effectiveness of interventions, including legal interventions, is a core component of the public health approach to prevention. Ideally, when we want to prevent bad things from happening, we apply this approach. First, we identify the problem and figure out how big it is. Then we identify the causes and consequences of the problem. And then we identify, develop, and test interventions that address those causes or that help ameliorate the consequences. Finally, we try to broadly disseminate the effective interventions. A wide range of public health problems have been addressed with this model right here in the Bloomberg School of Public Health, including infectious diseases, chronic diseases, injury prevention, environmental health problems, and many forms of violence. But this, as you heard Patrick say, is not the approach we take with child sexual abuse. Instead, we identified the problem, ignored or misunderstood the causes, and then jumped straight to juvenile and criminal justice interventions that were not tested before they were broadly disseminated at state and federal levels. The prevailing view of adolescents who engage in harmful or illegal sexual behaviors is that they are sexually and morally deviant and consequently at high risk to continue offending throughout their lives. The reality really could not be more different. Most children who engage in harmful or illegal sexual behaviors are not characterized by deviant or atypical sexual interests, and even those who are rarely reoffend once they've been caught. As you can see from this list, there is not one pathway to this behavior, but dozens. In addition, while children under the age of 18 do commit a large portion of child sexual abuse cases, relative to adults, their offenses tend to be more opportunistic, to involve less severity, and to have shorter duration. Also, as Patrick said, we know that these kids can cause harm. Nothing we say diminishes the harm that can be caused to victims. But we also know that youth who engage in these behaviors are highly responsive to evidence-based treatment. Moreover, sexual recidivism almost never occurs once a child has been caught. My friend and colleague, Michael Caldwell, has completed 2 separate meta-analyses. The latest combines information from 106 studies and more than 11,000 cases of children under the age of 18 formally adjudicated for sex crimes. And what he finds is that sexual recidivism is very rare. When we focus on the studies that were published most recently between 2000 and 2010, the sexual recidivism rate of kids who have been adjudicated for a sex crime is less than 3%. And I'll just add that my colleagues and I have examined the recidivism rates of all children in South Carolina, in Oregon, and in Maryland who have been adjudicated for sex crimes. These are very large samples. We've followed them for years. We get exactly the same finding. Less than 3% of them are ever reconvicted of a new sex crime. These are not a fluke. This is the reality. And together, these findings suggest the appropriateness of an individualized approach to the assessment, treatment, and when it's needed, the supervision of children who have engaged in harmful sexual behaviors. Unfortunately, misperceptions that these youth represent a uniformly high risk of sexual recidivism that is unlikely to abate over time or respond to treatment has led directly to the policies that we have today, where children caught engaging in harmful or illegal sexual behavior are likely to be adjudicated, segregated in prisons or residential specialized sex offender treatment programs for years, and following their eventual release back into their communities, they're subjected to sex offender registration, public notification, and a host of collateral consequences that are tied to registration, like residence restrictions, employment restrictions, and education restrictions. 38 states subject children adjudicated as minors to some form of sex offender registration and notification, and all states subject children adjudicated as adults to these policies. The anecdote of Johnny was reported in a 2007 New York Times Magazine cover article by Maggie Jones. The mother of one of Johnny's classmates had found Johnny on the registry, told her son, he told his friends. And word leaked out, of course, to other classmates who called him a rapist, a sex offender, threatened to beat him up. By the time the article was published, Johnny had switched schools and had had to switch caregivers several times, was struggling with depression, and attempted suicide at least twice. Why might a child attempt suicide after being subjected to sex offender registration? I want you to look at this list. This is a partial list of what it takes to be registered. Most of you are not, I suspect, are not very familiar with what this process is like. On your birthday, you go to a local sheriff's office or to the state police department to re-register on your birthday every year for however long your registration duration is. Durations last, depending on the state, from the period of time that you're on parole or probation, so several years, up to life. The federal government requires registration of children to last for life. Some states have refused to do this, but many, many states require it to last 10 years, 25 years, or still in many states for life. And this is what you experience on your birthday, and then 3 months, 4 months, or 6 months later. So you can easily envision why a child subjected to these conditions might consider taking his or her own life. And you can easily envision, I think, other, perhaps less severe collateral consequences. And that's what we wanted to study. There are literally hundreds of anecdotes like Johnny's. Many were compiled in a Human Rights Watch report that was completed by my colleague Nicole Pittman several years ago. But there have been, to our knowledge, no published studies that looked at the collateral consequences of registration directly on children. So I'm going to present the results, the latest results of a study that my colleagues and I have been doing that initially was funded by the Open Society Foundation, that received some money from the Annie Casey Foundation, and that the Moore Center has also been supporting. These are our collaborators. And what we did was to try to examine the impact of registration in 6 key domains important to children's well-being: their mental health, their own experience of victimization, their own sense of safety in the world, their perceptions of social support, and then also their own behavior. Does being on the registry change your own behavior? Does it make you more delinquent or less delinquent? Does it influence who you associate with? Are you more likely to associate with delinquent peers or prosocial peers? This is some information on the sample that we recruited. 256 children agreed to complete the survey. They were between the ages of 12 and 17, and they were from 18 states that were all across the United States. All of them, at the time that we recruited them into our study, were in active therapy for having engaged in harmful or illegal sexual behavior. And I think this is an important point that I hope I remember to return to. They were all in active therapy. And then you can see some other demographics that correspond reasonably well with what we know. Most were boys and so on. 29% of our sample was subjected to some form of registration and or notification procedures. And compared to the non-registered kids, the registered kids were a little bit older. They were more likely to have one formal adjudication versus none. They were more likely to have one victim versus none. And they were more likely to be white. Now, the first three of these make sense. Some states structure their sex offender registry programs to only focus on older kids, 14, 15, 16. So that makes sense. And of course, registration really only gets triggered if you have a formal adjudication, and you're most likely to have a formal adjudication if you have an actual victim. So these we were not surprised to see. This was surprising that more of the registered kids were white, and the reason is our recruitment strategies. We were able to recruit more registered kids out of states like Oregon and Washington that have relatively low racial and ethnic diversity. And then we recruited more of our non-registered kids out of states like Texas and places like Philadelphia that have relatively higher racial diversity. So this is an artifact. Nevertheless, we control for that in our analyses. So again, we were going to examine 6 key domains. We did not find differences between registered and non-registered children in terms of their own behavior or the behavior of their peers. Where we did find differences were along these domains of mental health, victimization, safety, and social support. Registered children reported significantly more mental health problems, more depression, more overall mental health problems, greater severity of suicidal cognitions, and they were nearly 3 times as likely to report having attempted suicide in the past 30 days. They were more likely to report having been sexually assaulted, a contact, forced, unwanted sexual assault in the past year. They were about twice as likely as non-registered children. And they were nearly 3 times as likely to be approached by an adult for sex in the past year. I think these things make sense. I mean, I think it's clear from what they endure why suicide might be on the table, and that's what we found. And if we think about what registration does, it alerts the world to the fact that here's a child who has had sex. And it alerts a lot of people, law enforcement agents. When they go to register, who else is registering? Sex offenders. Adult sex offenders are in those places. There are not separate places, nor would that, I think, make things any safer for them. And then sometimes we put their information on online registries, and literally we alert the entire world. At minimum, a child's school will be notified if he or she is a registered sex offender, even if they're not placed on an online registry. Hundreds, if not thousands of people know that this is somebody who has done something sexual, know that they're vulnerable because of the stigma associated with their behavior. And I think that that's what encourages people, predatory adults, to take advantage of them. They also reported, not surprisingly, a significantly lower sense of safety. The other surprising finding that we found is that registered kids reported higher social support from their friends and family. And I think there's a logical explanation for this. I think that the therapists and the family members and the friends that stuck with these kids, even though they were registered sex offenders, kind of the worst of the worst, understood that they needed to step up their game to address the harms caused by registration, to try to ameliorate the effects of registration. So this actually makes sense to me, although I certainly admit that it was unexpected. Now, as I said, our registered sample differed from our non-registered sample on some key demographics like age and race, and on some criminogenic variables like having a formal adjudication, acknowledging at least one victim. And so we reran our analyses controlling for those differences. And the first thing I want to say is that all of the results were in the same direction as before, but we lost a little power to detect statistically significant differences. The differences that remain significant was suicidal cognitions are still significantly higher for our registered children. Sense of safety is still significantly lower for our registered children. And we still have this effect of greater perceived social support among our registered children. The factors that are no longer significant, statistically significant, but that I think are still really quite relevant and worth discussing are the increased risk of, or not the increased risk, but the increased report of suicide attempts. Registered children had an odds nearly 4 times greater than non-registered children of attempting suicide, again, just in the past 30 days. They have 2 times the odds of having been sexually assaulted, again, with a contact, unwanted sexual assault. And they're nearly 3 times the odds of having been approached by an adult for sex, even after we account for the fact that they were a little bit older. One could argue, and people do, that if registration worked to improve community safety, it could and perhaps should still be applied to children despite these horrific collateral consequences. Which begs the question, does registration work? Does it make any of us any safer? And the answer is a resounding no. My colleagues and I have published, I didn't do a count, so I can't remember, but somewhere between 6 and 10 studies that join a few other studies. All of them find the exact same thing. Every single time we evaluate registration and notification, we find no relationship between those policies and first-time sex crimes or sexual recidivism rates. Those are the only 2 ways these policies could improve community safety, is if they kept kids from engaging in these behaviors in the first place, or if they kept kids from engaging in them again after being identified, and they don't do that. It is unusual to find this degree of consistency in the published research and in the published science, but that is what we find. We find evidence of other harmful and unintended effects. We find no evidence of intended effects. At this point, 9 different states' policies have been evaluated, plus the federal government juvenile registration policy, and none of them work. Those policies are all very different, but the results are the same. This is a failed policy. It's misaligned with the causes of child sexual abuse, and is poorly suited to the realities of adolescence. So here, I'm actually paraphrasing my friend, actually I'm plagiarizing my friend Patrick McCarthy, who has spoken and written eloquently on the need to close youth prisons, not just youth detention centers, but youth prisons. And I really want to draw your attention to this middle paragraph. Rather than improving safety, registration, akin to youth imprisonment, communicates constantly and in a variety of ways that registered children are dangerous, feared, worthless, with no real future. And clearly, these children have picked up on that message. As this evidence accrues, it becomes, I think and hope, increasingly difficult to reconcile why we persist in policies that are not only ineffective and immensely costly, but that are so demonstrably harmful to children. Fortunately, we are seeing some change. 2 different attorney generals have walked back federal registration requirements. They still exist, but they have walked them back. At least 2 states have voluntarily walked back their own juvenile registration, often from requiring lifetime registration to something less than that. And in several cases now, state Supreme Court findings have forced policymakers to change their registration requirements as those requirements pertain to children. My hope is that our latest research will convince even more policymakers that the time has come to abandon juvenile registration. Thank you.